Let's get right into things today because we have so much to discuss. I'm not going to waste 10 minutes with a meta segment telling you what's going to be on today's show. I mean, this is the show. Let's just do the show, right? That's my perspective. I told you yesterday that today we would talk about a sort of new, it's almost like an anti-consensus. Increasingly, the consensus from scientists about COVID and the trajectory of this pandemic is the end is uncertain. We don't actually know. And you'll still hear some individual public health experts and epidemiologists and others say, if we do X, we'll probably be mostly back to normal by some date. But at this point, it should be pretty clear to most of us that it's not clear when this is going to end, and that the ifs that are often referred to, if we get to this level of vaccination, if there is no more contagious or dangerous variant, these are ifs over which we really have very little information, and it's significantly unclear. So I want to start here with an article that outlines this. For scientists, path to COVID endgame remains uncertain. This is by Mark Fisher from the Washington Post from this weekend. It's basically over already. It will end this October, or maybe it won't be over till next spring or late next year or 2 or 3 years down the road. From the most respected epidemiologists to public health experts who have navigated past disease panics, from polemicists to political partisans, or partisans, as some like to say, there are no definitive answers to the central question in American life. As a Drudge Report headline put it recently, is it ever going to end? With children returning to classrooms in many cases for the first time in 18 months, and as the highly contagious Delta variant and spotty vaccination uptake send case numbers and deaths shooting upward, many Americans wonder what exactly has to happen before life can return to something that looks and feels like 2019. The article rightly pointing out the answers come in a kaleidoscopic cavalcade of scenarios, some suggested with utmost humility, others with mathematical confidence. The pandemic will end because deaths finally drop to about the same level we're accustomed to seeing from the flu each year. Or it will end when most kids are vaccinated. Or it will end because Americans are finally exhausted by all the restrictions on daily life. Innumerable predictions over the course of the pandemic have come up lame. Some scientists have sworn off soothsaying, but as they learn more about the coronavirus that bestowed COVID-19 on mankind, they build models and make projections and describe the hurdles that remain before people can pull off the masks and go about their lives. The good news is there is some fuel for optimism. And I think that this is accurate in terms of the possibilities of optimism. Let's look at what it says. I truly, truly think we are in the end game, says Monica Gandhi, an infectious disease specialist. The cases will start plummeting in mid to late September, and by mid-October, we will be in a manageable place where the virus is a concern for health professionals, but not really for the general public. That is very optimistic, but we are seeing, if you expect cases to be much lower in October, the leveling off we've seen over the last 7 days suggests that that's a possibility. Gandhi bases her optimism on the fact that all previous epidemics of respiratory viruses have ended through the acquisition of immunity, whether vaccination or natural infection. Although viruses do keep changing, potentially circumventing people's defenses, they mutate quickly at a cost to themselves, weakening over time. Our guest, Vincent Racaniello, last week from the This Week in Virology podcast said the same in terms of the mutating to be less serious. Gandhi said she believes the Delta variant that has hit the U.S. so hard this summer will mark the peak of the virus's strength. But Gandhi warns she has been wrong before. In February 20, she said the U.S. would not tolerate a disease that killed 100 Americans a day. People would come together and do whatever it takes to stop that. That didn't happen. The bad news is there is too much cause for doubt. Zeke Emanuel, professor of medical ethics at UPenn. We're in a moment of uncertainty and humans don't do well with uncertainty. Telling people it's going to be 2 or 3 more years of this is really hard. But I don't think anyone can be comfortable with the current state, with a lot of kids ending up in the hospital and 1,000 deaths a day. That's not returning to normal. And Emanuel also says his crystal ball has sometimes been cloudy. In March of 20, he said the country would be back to normal in November of 21. For that, his friends dubbed him Mr. Pessimist. Now his message is at least as unwelcome It's going to be at least spring 22 and possibly much longer before things go back to normal. So at this point, this is as much a psychological question of what does it do to society to be living with this for we don't know how much longer. Now, that psychological pressure has pushed some who never took it super seriously to just say, we're back to normal. Either I'm vaccinated and we're back to normal, or I'm not vaccinated and I never thought we needed vaccines or to do anything, and I'm going to continue in that way. But when you look at the case and death numbers, tomorrow I'm going to actually show you cases are 3 times higher than a year ago. Deaths are 2 times higher than a year ago. That doesn't feel like it's almost over. But at the same time, you've got some points of optimism. There are some studies that show that an overwhelming majority, 80 even more percent of some populations in some cities have some degree of antibodies, which would be due to a combination of infection, vaccination, people who never knew they had it, asymptomatic cases, et cetera. So what is the point of this? Do we really know anything? No, yes, maybe, I don't know. We do know some things. We know that this mutates slowly enough that when you start getting to these higher levels of immunity, you may not do away with cases, but cases won't mean nearly as much because it will mostly mean colds. And for the vaccinated population, that's sort of already the case. I mean, when you read 1,500 vaccinated people have died, it's hard to feel like that means if you're vaccinated, this no longer matters. But in the grand scheme of the numbers, that's a quite small number. People die of the flu, even when vaccinated, etc. So the last part of this is, how do we define the end? Are we comfortable saying the end is when the death numbers are the same as a normal flu season? Is that the end? Has this so traumatized us that even that won't really signify the end? Will it be where anyone of any age who wants to get vaccinated can be vaccinated, which could be some time until young kids can get vaccinated? That's another piece of this, which is how do we define the end? The next thing I want to talk about is this Mu variant, MU, which many of you have been emailing me about.